Duty Area 5 with Hope Care Love Home Healthcare Services, Medication Management. Diabetes. Okay, so let's help you understand what diabetes is. Let's look at it as to what ordinarily occurs in the body when you eat. As the food you eat is digested, it breaks down into sugars and it enters into your bloodstream, okay? This blood sugar is called glucose, right? And it acts as a fuel to give your body the energy it needs, okay, for the activities that you do every day to get up and move around and all that stuff. The fuel must get into your body cells before it can be burned, though, into energy. Insulin helps get the sugar from the blood into the cells. Normally, the right amount of insulin is produced by your body in a gland called the pancreas, okay? So with normal insulin, the pancreas produces the insulin. The insulin helps get glucose into the cells, and then the cells burn glucose to perform energy that your body actually needs. So you have your cell, and the glucose gets in the cell. Well, when the glucose gets in that cell, you're good because now the energy is going to produce what you need, okay? But with diabetes, it's a condition where the body either does not produce any insulin at all, or it doesn't produce enough, or it cannot effectively use the insulin that it does produce, okay? So when the body cannot produce or use insulin effectively, the sugar in the body cannot be maintained, right? And it does not stand, it's not normal. The sugar builds up in the blood and eventually leaves out the body in the urine. Yes. Right? Although there's no cure for diabetes, it can be controlled with diet, exercise, medications, and insulin treatment. Okay? When you don't have enough insulin, that means the glucose, remember the glucose, it can't get into the cell. It can't get into that cell. Nope. It stops. Can't get in the cell. So if the cell can't burn glucose for the body, what? You don't have enough energy. And then what happens? The sugar is going to build up in your blood because it's not getting into those cells. So there's two main types of diabetes. The main types. You have your insulin dependent, which is your body produces no insulin, and that's type 1. And there's non-insulin dependent, which is type 2, which is basically you did it to yourself over time. Okay? I'm not supposed to say like that, am I? Okay? So, symptoms of diabetics. So, frequent urination, which is polyuria. You're really thirsty all the time. You're hungry all the time. Unusual weight loss. I must not be diabetic. Increased fatigue, meaning you're tired, irritable, and blurry vision. Those are some signs of a diabetic. Okay? Type 1 diabetes requires injections of insulin on a regular basis to keep the body supplied with enough insulin. In addition to the insulin injections, people with type 1 diabetes need to follow a special diet and exercise plan. Type 1 diabetes is usually found in children and adults under the age of 30. Okay? Although no one knows exactly what causes type 1 diabetes, we do know there are some contributing factors, which is hereditary, physical stress or injury, and then viruses that have damaged the pancreas. Okay? People with type 2 diabetes can often keep their body supplied with the needed insulin by following a special diet and exercise plan. Sometimes they must use oral medication or insulin to help out with that diet and exercise. Type 2 diabetes is usually found in people over the age of 40. How old are you? Have you been checked? And what you're checking is, it's a lab. It's a blood test. It's called a hemoglobin A1C. And that tells you if you have been naughty or nice. Contributing factors to type 2 diabetes is hereditary. That's one. Physical stress or injury can still be one. Over the age of 40. Excessive weight. And having poor eating habits. Okay? So, you want to manage your diabetes. And managing the diabetes is going to be truly based on a lot of effort. You have to be able to diet, meaning watch what you eat, watch your carbohydrate, watch your sugars. You want to exercise effectively and efficiently. Get out there and get a nice heart rate up and get your body, keep your weight under control. You want to ensure that you're drinking plenty of water. That's like the answer for everything, right? Sometimes you have to make sure that you're taking your insulin. doing your test, your finger sticks, and sometimes it may require ketone testing, which is in the testing your urine. It's always important to meal plan and exercise. Is it optimal? It can be. That is the one thing or the two things that you can control. Okay? You can't control your hereditary part of it, right? So, what are some things to look out for when they're diabetic, right? You want to make sure that when someone is showing signs and symptoms of hypoglycemia, which is low blood sugar, get it? Hypo, low. You want to ensure that you are paying attention to the signs and symptoms. And normally, that's when the blood sugar drops a little bit below 70, and they get weak. They get shaky, a little irritable, maybe confused. If this starts to happen, you want to ensure that you catch it before it gets too low. Okay? Some other signs that you want to look out for is being sweaty, nausea, shaky. They pass out. That's a big issue. Clammy skin, nervousness, weakness, rapid heartbeat, numb lips and tongue. Now, if my blood sugar is getting too low and I need to treat it, it could be treated by giving some type of carbohydrates, which is 15 grams of carbohydrates. But if you can't count the grams, you need to give it. Wait 15 minutes and test the blood. Okay? So a good thing is peanut butter. If they can drink, give them milk, cheese. If they need something quick, give them Snickers, candy, but that's going to make them drop really quickly. Okay? But a 15-15, which is 15 grams of carbs, and then wait 15 minutes, okay? Don't over-treat hypoglycemia. You want to give maybe 4 ounces of juice, 6 ounces of a soft drink that's not diet, a tablespoon of honey, 3 to 4 teaspoons of sugar, 2 tablespoons of raisins, 8 hard candies. These are a couple things that you should carry around with you and have available for those who are diabetic. If their hypoglycemia goes untreated, they may faint or lose consciousness or experience a seizure, requiring, help, and it could progress to death. People who are unconscious or unable to eat should be given an injection called glucagon, and it's going to raise their blood sugar quickly. If they have this type of reaction and pass out, 911 must be called. Okay? Hyperglycemia. Hyperglycemia is too much food or the wrong foods, too little or no exercise, too little diabetes medication or not taking the diabetes medication that's been instructed, too much stress, infection or illness, diabetes medication not being used properly in the body, menstruation, any one of these things or combination of these factors may cause high blood sugar. The best way to know if your blood sugar levels are within normal target range is a test. Take a test, okay? And if you're having these issues and you're trying to target, you want to look at, did you plan your meal? Did you skip your exercise? Did you decrease your exercise? Did you take enough of your diabetes medication or your insulin? Did you forget to take your diabetes pills or insulin? Were you stressed about something? These are all things, or do you have an infection? All of these can cause hyperglycemia, which is high blood sugar. Now, fatigue goes with both of them, so that's not a key. I mean, it's a factor, but it's not a factor that can tell you which way to go. Test. But if they're always hungry, always thirsty, they're urinating a lot, blurred vision, dry, itchy skin, poor healing of wounds, flu-like aches, headaches, one or more of these signs may indicate their blood sugar is high. They can often be subtle or appear to be caused by other conditions. People sometimes ignore the warning signs of high blood sugar and then causes catastrophic concerns. To prevent diabetes or hyperglycemia, pick your medication as prescribed. Follow your meal plans. Follow your exercise plan. Keep your stress level down. If you've been sick or you've had any infections, try to heal them as quickly as possible. And check your blood sugars frequently. Okay? There's a couple different types of insulin that you can be given. There's intermediate, there's short acting, and there's long acting. And then You want to make sure you're taking your blood glucose test, which is your finger stick. And then sometimes you have to get your labs, which tells you how well you've been behaving over 6 months. Okay. Abnormal labs will then maybe change the type of medication that you get. All right. Diabetes can be fatal, so it's very important that you pay very close attention to your blood sugars and ensure that you're taking your medication and eating your diet that you're supposed to. Diabetes can be lived with without any complications if you follow the regimen that your physician has given you. As a support, we want to ensure that we're checking blood sugars. We want to ensure that we are giving the medication that's appropriate for blood sugars or diabetics. We want to ensure that we are giving the proper meals for diabetics. Just because there's no sugar on their plate doesn't mean their plate is not healthy. If I'm giving them lots of potatoes, lots of carbs, and things of that nature, rice and bread and spaghetti all the time, I am now contributing to their high blood sugars, and that is not healthy. So it's very important to have a well-balanced diet. Keep your stress levels down and ensure that you are paying attention to what your levels are at all times. And when you start to have those symptoms, it's okay to check. And if you're seeing that your numbers are high or low, treat it accordingly. Diabetes is something that you must continue learning about. You must continue reading about. You must continue to ensure that you are educating yourself, because someone with diabetes is delicate and they can have issues arise that become worse issues if not addressed accordingly at the very beginning. Okay. If you're having to give insulin must be on rotated sites. You must ensure that you are documenting what site you gave it on your medication record. You're normally going to give it in a fatty area, and that's called, and then the needle is a subcutaneous needle. We call it subcutaneous. And you're going to wipe the area with alcohol, let it dry, pinch the area, and you inject. A lot of times it's the shoulder blades, your belly, the back of the arm. There's other places that you can give it, like in your thigh, your buttocks, but primarily it's going to be in your arms and your belly. And that is pretty much diabetes in a nutshell. It's a basic understanding. You will continue to be groomed. You'll be continued to be taught. You'll be continued to be shown the different ways to understand diabetes.